hear a sound in your ear that matches your heartbeat, almost like a whooshing or pulsing rhythm that just won't go away? That might not be your imagination. It could be a medical condition called pulsatile tinnitus. Hi, I'm Shema Yalchinkaya, Doctor of Audiology, a tinnitus specialist, and the author of Living with Tinnitus book. Today, I want to talk to you about a very specific and often confusing type of tinnitus, pulsatile tinnitus. This video isn't meant to scare you, I promise, but if you have been having a sound that pulses with your heartbeat, you will want to stay tuned. In this video, you will learn what pulsatile tinnitus sounds like, what causes it, how it's diagnosed, treatment options that really work, and what to do if there is no known cure. Alright, let's get started. Tinnitus is any sound you hear in your ears or head that doesn't come from an outside source. It could sound like ringing, buzzing, or even something strange like a kettle boiling. But pulsatile tinnitus is a bit different. It actually follows the rhythm of your heartbeat. Let's listen. How does it sound? Pulsatile tinnitus is often linked to the blood flow in your head and neck. Unlike regular tinnitus, it usually has a physical cause, and the good news is it can be often treated once that cause is found. So, how do you know if what you're experiencing is a pulsatile tinnitus? So if you experience a rhythmic sound in one ear in sync with your heartbeat, whooshing, swooshing, or throbbing noise, louder in quiet environments, headache, lightheadedness, or dizziness. If these symptoms sound familiar, you are not alone. Many people go months or even years without a diagnosis, thinking it's just stress or earwax, but it could be something deeper. Let's talk about what could actually cause this. Here are the 8 potential reasons for pulsatile tinnitus based on current research and clinical findings. The first one is atherosclerosis, hardening of the arteries. So, atherosclerosis refers to the buildup of fatty deposits in your arteries, which can cause them to become stiff and narrow. When blood flows through these narrowed vessels, it can create turbulent flow, similar to how water in a river changes when it encounters obstacles. This irregular flow can produce sounds that are heard as pulsatile tinnitus, especially near the ear. The second cause can be sinus wall abnormalities. So your sinus wall is a passage near your brain that drains blood from veins in your head. In some individuals, abnormalities can lead to excessive blood flow in this area. This heightened circulation can create a whooshing or pulsing sound, contributing to the experience of pulsatile tinnitus. And the third cause can be arteriovenous malformations. Arteriovenous malformations are abnormal connections between arteries and veins, forming a tangle of blood vessels. If such a malformation occurs near your ear, it can interfere with normal blood flow and create pulsatile tinnitus, as the sound of blood moving through these irregular pathways become audible. If you found this video helpful and want to see videos like this, don't forget to give it a thumbs up and hit that subscribe button to join our community. And make sure to turn on the notification bell so you never miss out on new videos just like this. The fourth cause of pulsatile tinnitus can be high blood pressure. So high blood pressure means the force exerted by blood against your blood vessel wall is higher than normal. So this pressure can affect the blood flow, making it more forceful and turbulent, which can lead to the sounds associated with pulsatile tinnitus. 5. Anemia. Anemia is a condition where your body lacks enough red blood cells to carry oxygen effectively. To compensate, your body may increase blood flow to try to deliver more oxygen to tissues. This extra blood flow can put pressure on the blood vessels near the ears and create the sensation of pulsatile tinnitus. Next, certain benign tumors, so middle ear tumors such as glomus tumors, can develop in the middle ear. These tumors are highly vascular, meaning they have a lot of blood vessels. When blood flows through these vessels, it can produce sounds that are perceived as pulsatile tinnitus. Some cause can be idiopathic intracranial hypertension. Idiopathic intracranial hypertension occurs when there is an increase in cerebrospinal fluid pressure around your brain, putting extra pressure on the blood vessels. This change in pressure can affect blood flow and cause pulsatile tinnitus. The last one is head trauma. Head injuries, especially those that result in trauma to the brain or inner ear, are often linked to tinnitus. About half of individuals who suffer from head injuries may experience tinnitus, including the pulsatile type, which is thought to be caused by changes in blood flow or damage to the auditory system. How is it diagnosed? A proper diagnosis typically starts with a hearing test, followed by imaging studies like MRI or CT scans, and sometimes blood tests to rule out systemic issues. Depending on your symptoms, you might work with an ENT, neurologist, or even a cardiologist. And trust me, getting the right team can make all the difference. Now let's talk about what everyone wants to know. How can I treat? If your doctor finds an underlying cause, such as a vascular issue or high blood pressure, treating that often results to tinnitus. In some cases, surgery is needed, like correcting a vessel or removing a tumor. Reducing salt, caffeine, and stress can make a real difference. As an audiologist, I often guide my patients through sound therapy tools and coping strategies. These are especially useful when no treatable cause is found. Now, sometimes even after all the tests, we don't find a clear cause. That doesn't mean you have to suffer. There are effective management tools like sound therapy, counseling, and mindfulness training that can help reduce the perception of the sound and improve your quality of life. If you have been struggling with pulsatile tinnitus, I hope this video helped you feel more informed and more hopeful. You are not alone, and there are professionals who can help. Thanks for watching, and I will see you in the next one.